This is breaking news from the Las Vegas Review-Journal, sponsored by Michael Gaughan's South Point Hotel, Casino, and Spa.
Hello everyone, I'm Renee Summerhour with the Las Vegas Review-Journal. We're going to be taking you live to a ceremony where Governor Steve Sisolak is expected to sign a bill to establish a public health insurance option in Nevada. Let's go ahead and take a listen.
I see you. I see you with your matching dresses. Yeah. I want his job.
So again, as we prepare this bill, Senate Bill 420, which we'll be hearing about in just a moment, will make Nevada the second state in the U.S. to enact a public option. Now, it's important to note that even though it's being called a public option, that doesn't mean Nevadans would be buying health insurance directly from the state. So again, they're going to explain, and there could be a number of other bills that the governor will be signing today. Now, the bill creates something closer to a public-private partnership, and under the bill, insurance companies that take part in this, Nevada's Medicare program, will be required to offer middle-tier plans. So let's go ahead and take a listen.
Okay, thank you so much to Senator CANNIZZARO, Speaker Frierson, for passing this bill. And I also want to thank Governor Sisolak for being here today to sign this bill. I am so grateful for the Nevada public option for so many reasons. As a healthcare provider, I know the Nevada public option will help our patients by making healthcare more affordable and accessible. And it will also help providers such as myself make sure that, people like myself are more adequately reimbursed for the healthcare services that we provide. As a small business owner, I personally know the high cost of providing health insurance for our employees. The Nevada public option will make it easier and less expensive for us to take care of our staff. So again, I want to say thank you, Senator CANNIZZARO and Governor Sisolak, for this incredible improvement to our healthcare system. The Nevada public option is truly a blessing for us and a blessing for our community. So thank you all. And with that being said, I'm going to introduce to you Governor Sisolak.
Thank you. Thank you so much. Thank you, Shaniqua. I really appreciate it. And I want to thank my staff for putting my remarks in a binder today. The other day I had them loose and the wind was blowing and they went all over the place. So you got me. I got the best staff in the absolute world. So thank you for that. Again, thank you all for being here. Shaniqua, thank you for hosting us and the introduction today. I'm excited to be here at Care with Purpose Medical Center to sign three very important pieces of legislation into law today. The COVID-19 pandemic has taught us that health is wealth, and I am committed to finding ways that we can increase access to health care as we take steps to strengthen our public health systems across the entire state. While we have weathered the storm together with our battle-born spirit, COVID has exposed the fact that our state must strengthen our public health infrastructure. Today, we're taking steps to do just that by signing 3 bills into law that help us move forward as a stronger, healthier Nevada. First, I will sign Senate Bill 209, sponsored by Senator FABIAN. This legislation requires certain employers to provide paid leave so employees can take off the time they need to get the COVID-19 vaccine. As we continue our historic vaccination effort, this is one extra way we can help ensure Nevadans don't have to choose between their health and their livelihoods. This legislation also requires the Interim Committee on Healthcare to study and make recommendations regarding the state's public health infrastructure and COVID-19 response so that we are better prepared for whatever comes our way in the future. And I certainly hope it's a long, long time before we ever face another pandemic like we just went through. I will now sign SB 209 into law and then ask the senator to say a few words.
People have ran off. You'll never believe it.
Not necessarily intentionally, but that's the problem. Good? Okay.
Thank you. Podium's yours.
Thank you so much, Governor Sisolak. Today is a very exciting day for me. Three years ago, I graduated from UNLV, and I graduated from the UNLV School of Public Health. And at that moment in time, I had a very tough time finding a job. And I didn't realize that at that point it wasn't because there wasn't any, it wasn't because of my professors or because of my curriculum. It was because our state didn't have the right infrastructure in place to support public health students into the workforce. But what we've learned from this pandemic is one thing, and that is that public health is everything. It's our livelihood. That's what this bill does today. SB 209 guarantees the right to get the vaccine for those who need it most. It allows 4 hours of paid leave as of this moment, thanks to Governor Sisolak, for people to get the vaccine and leave work. But not only that, it takes into consideration the public health infrastructure mechanisms that we have in place whenever an emergency occurs. We will use this moment to learn about how we can fund public health better so that when a pandemic or an emergency occurs, we have the right people and steps in place to protect Nevadans. That's what today is about. I want to thank a few groups. We have the Make It Work Nevada, the Nevada Justice Association, Culinary Union, the Vegas Chamber of Commerce, the Nevada Resorts Association, the Retail Association, so many groups that came together to make this moment possible. This is the right moment for this bill, and we can use SB 209 to finally close off this chapter of this dark history in Nevada and move forward for a healthier Nevada for all. So thank you again, Governor.
I tell you what, I've done several bill signings with the senator. Nicole, you put him to work fast. I mean, this guy, I got to meet his mom and dad, came to a bill signing, I think it was yesterday. And I want to point out that we came down, Joy is here from my office, who's the one responsible for handling these bills. I don't know where she is. We flew down here specifically to sign some of this legislation. It's that important. We wanted to bring it into the neighborhoods and into the community. So next I'm going to talk about, this is one that you've heard so much about, Senate Bill 420, the public option bill. That was sponsored by Majority Leader Senator NICOLE CANNIZZARO. As I mentioned, I'm always looking for ways to expand healthcare opportunities in Nevada for Nevadans. And that's what this legislation does. By leveraging the state's existing healthcare infrastructure and reducing costs, it is my hope that Nevadans will have improved access to comprehensive insurance. This legislation also includes expansion of coverage for doulas and midwives for pregnant women in order to reduce maternal mortality rates in Nevada, a cause that has been championed by Assemblywoman Danielle Monroe Moreno. Thank you. As I've mentioned before, we've got a top-notch team at the Silver State Health Exchange, and they'll be taking the lead in coordinating with the Department of Health and Human Services and the Division of Insurance to apply for the necessary waivers and plan for 2026 implementation of this bill. I look forward to coordinating with the exchange and others over the next several years while these plans are being explored and developed. I will now sign SB 420 into law, and then I'd like to ask Senator CANNIZZARO to say a few words. Senate Bill 420. The date is 6/9/21.
And your time is 12:15 p.m.
Who else wants to hold it? Okay, not gonna hold it?
There we go. Last one there. Oh,
You got it? All yours, Nicole.
Mine are not in the handy dandy binders.
Yeah.
Fly away. Right.
I love
Hello, everyone, and a huge thank you to Governor Sisolak for his support of the Nevada public option. And I can't thank again Dr. Hawkins as well, Shaniqua, news practitioner. I always want to call her doctor. I've given her that promotion for having us here at Care with Purpose Medical Center and for doing so much to help advocate on behalf of this really good bill that I think is going to help to reduce the barriers to access to affordable and accessible health care for all Nevadans. I am proud to be here with all of you today as the Nevada public option is signed into law officially, which will expand access and create more affordable health care options for the people of Nevada. I also want to thank Speaker Frierson for co-sponsoring this legislation. It's a team effort. You can't do it alone. And Senator Doñate for all of his really hard work in helping to carry this across the finish line as well. I especially want to thank Assemblywoman Danielle Monroe Moreno for her tireless efforts, and I can't overstate the work that she has done in the maternal health care space enough. But for her efforts on maternal health, and we are so proud to see that this bill will help to open up some more doors in critical investments in prenatal and maternal care and Medicaid for Nevada moms and babies right here in our Silver State. Of course, we have to thank the many advocates who are here with us today and community organizations who were with us from the start to help make the Nevada public option a reality. I grew up in a typical working class family right here in Las Vegas, and my parents were members of a union, which to me meant that we had access to health care. We didn't have some of the same worries that so many Nevada families have with whether to make the choice to get medical care for their children or to not seek that medical care. For my family and for so many working families when I was growing up, even though we were working class, we knew that if we had a medical emergency or we needed to see a doctor, that a small copay could ensure that we would have that access and affordability. We didn't worry about crippling medical debt because a medical issue came up. And we didn't live with the fear that it might bankrupt us because we had health insurance coverage. But today, there are so many working families and middle-class families that just don't have that same assurance. They don't have those same benefits that they need. They're struggling to afford access to health care, and they worry about the cost of care. It's not just families that are worried about the cost of care, it's also small businesses. Small business owners who are struggling with healthcare costs
and providing coverage options for their employees. Consistently, one of the most common things that I hear from Nevadans, whether it's knocking doors in my district, which is just a short little jump that way, or in Carson City when they come to advocate, is the cost and the worry that comes with access to health care. Everywhere that you go in this state, that is something that is on the top of people's minds. And it relates to not only the affordability and accessibility, but it affects every aspect of patient experience, from decisions about whether to seek care to the impact of medical bills after receiving care. And importantly, it affects the decisions about seeking and getting health insurance coverage. We are here today because we believe that every Nevadan should have the security of knowing a trip to the doctor or unexpected medical emergency won't lead to crippling debt. Today, as Governor Sisolak has signed this bill into law, we will become one of the first states in the nation to have our own public option in law. The Nevada public option will allow us to leverage our state's purchasing power and provide some cost relief that Nevadans have been asking for. As we move forward, I am committed to working closely with the governor and with our amazing staff at Health and Human Services to ensure that the Nevada public option is successful and implemented in a way that can provide Nevadans with more affordable care and better health outcomes, because they deserve that. And that's exactly what I'm so proud we were able to deliver with the help of all the folks who are here with us today. So thank you so much, Governor, for being an advocate for public health. Thank you to everyone who helped move this bill across the finish line, and can't wait to see what we're able to do in the next few years as we implement this into law. Thank you, everybody.
And as we progress on the bill signing today, and I want you to notice, and I appreciate the media that's here today to spread the word to the community about this happening, but all the other folks that you see here that don't have a TV camera with them or a still camera are the ones that did a lot of hard work. They showed up every single day. They lobbied hard. They talked to legislators. They convinced them how important this was. And without their efforts, it would not have been possible. So we appreciate the efforts that were brought forward. Thank you. Thank you, Senator, for your comments. The final bill I'll sign today here, I've got to go to sign some other ones other places, is Senate Bill 424, which will create the Public Health Resource Office to analyze the existing infrastructure for meeting Nevada's public health needs. Throughout this pandemic, we've relied on public health professionals, nurses, doctors, the Nevada National Guard, who's just been absolutely outstanding, and so many community members and organizations to ensure that we take care of those who need help, follow the best science available, and mitigate the spread of COVID-19 as much as possible. I'm so grateful and thankful for these leaders and Nevadans who stepped up in our most desperate time of need. Because of their work, we are in a much better spot than we were just a year ago today, when I think back on where we were a year ago. And it's not without the help of a great group of Nevadans that we are in a better spot today. Senate Bill 424 positions Nevada for the future, because whether we face a crisis or not in the future, and hopefully it's or not, we know we need a stronger public health system for Nevada families. By creating a public health resource office, we will be more prepared than ever before. We will be able to identify and make recommendations concerning the state's utmost unmet needs and find opportunities to obtain federal or private funding to support public health services, and look at ways in which the state can improve the coordination between providers of the healthcare services and the delivery of that healthcare to the people that need it most, the patients. I'm grateful for the work from my team, including Heather Korbulik, Caleb Cage, Director Richard Whitley, and Julia Peak from the Department of Health and Human Services, and Scott Gillis and Michelle White, my staff, who've been absolutely incredible in ushering this forward. And you see a few others. I already introduced you to Joy. I've got Randy Brims here. I've got Megan Delaney. I've got an incredible staff, and I'm so thankful for the work that they did in making all of this a reality. So thank you for helping us move this forward. I will now sign Senate Bill 424. Thank you all very much for joining us here today. These were extremely important pieces of legislation. And I know I've had a few more legislators show up. Senator Spearman's here, and the others we've introduced or they've been spoken about. None of this would be possible without the great help from our legislators. None of it. I mean, Danielle, Jason, Fabian, Nicole, Pat. I mean, these are some people who I'm telling you give an awful lot of themselves. You take an awful lot of criticism. They know that. They knew that going in. And it can be thankless at times, but it's at moments like this that you realize what a tremendous difference that you make. And this is a tremendous difference that you're making. And you will be impacting the health of Nevadans for decades to come. And for that, on behalf of 3 million people who call Nevada home, thank you all very much. Thanks for being here with us, folks.
You just watched Nevada Governor Steve Sisolak sign several health bills into law, including one that establishes a public option insurance plan for the state. He also signed Senate Bill 209, allowing certain employers to require paid leave to employees for the vaccine or for vaccine purposes. He also signed Senate Bill 424, creating a public health resource office so that the state of Nevada is more prepared for any future emergencies that may come up. Now, we will have more on this story online at lvrj.com, and we will have an update on all of today's events for you this evening on 7 p.m. You can also download our free RJ mobile app to get these types of breaking news alerts sent straight to your phone. And as always, you can find us on Roku, Apple TV, and all of your favorite digital platforms. I'm Renee Summerauer. Thank you for watching.
You've been watching Breaking News from the Las Vegas Review-Journal, sponsored by Michael Gaughan's South Point Hotel, Casino, and Spa.